Hello, my name is Dr. Michael Hanrahan. I'm a public health doctor and I'm delighted to be partnering with Medicare to talk to you about men's health. In this video, we're going to be talking about hypertension, which is high blood pressure. So blood pressure refers to the force of blood against the inner wall of your arteries. And blood pressure normally rises and falls throughout the day, depending on what you're doing. So for example, your blood pressure is lowest while you're asleep and highest while you're exercising, and that's completely normal. About 1 in 3 people worldwide have high blood pressure, and persistently high blood pressure can scar, stiffen, and/or weaken your blood vessels. And that is why high blood pressure is the biggest contributor to disease and mortality worldwide. Next, we'll talk about the causes of high blood pressure. And when we talk about the causes of high blood pressure, we usually split it into 2 different categories: the non-modifiable causes and the modifiable lifestyle causes of high blood pressure. The non-modifiable causes include age, gender, and genetics, while the modifiable lifestyle causes include smoking, being overweight or obese, having a poor diet, having too much salt in your diet, drinking excessive amounts of alcohol, lack of physical activity, and chronic stress. So unfortunately, high blood pressure doesn't usually present with any symptoms, and that's why it's important to monitor your blood pressure regularly. The complications of high blood pressure include having a heart attack, stroke, heart failure, vision loss, chronic kidney disease, peripheral artery disease, which means having pain in your legs, dementia, and erectile dysfunction. Okay, so when you're taking your blood pressure at home, it's important to know what the different numbers mean. So most blood pressure machines look exactly like this. You've got a systolic blood pressure measurement, a diastolic blood pressure measurement, and your heart rate. The systolic blood pressure measurement is the bigger number on top, and that refers to the amount of pressure required to close off your blood vessel when your blood pressure is at its highest. The diastolic blood pressure is usually the lower number, and that refers to the pressure required to close off that blood vessel when your blood pressure is at its lowest. And the heart rate refers to how many times your heart beats per minute. So now we're going to discuss what the different blood pressure measurements actually mean. So when we talk about normal blood pressure, we usually say that it's 120/80 millimeters of mercury. As you can see in this table, the normal blood pressure is having a systolic blood pressure between 90 and 119 millimeters of mercury, or a diastolic blood pressure of between 60 and 79 millimeters of mercury. Pre-hypertension is having a systolic blood pressure of between 120 and 139, or a diastolic blood pressure between 80 and 89. And if you have pre-hypertension, it means that you should work on those modifiable lifestyle causes of high blood pressure that we discussed earlier to help prevent or reduce the need for you to take high blood pressure medication in the future. Grade 1 hypertension is having a systolic blood pressure between 140 and 159, or a diastolic blood pressure between 90 and 99. Grade 2 hypertension is having a systolic blood pressure between 160 and 179, or a diastolic blood pressure between 100 and 109. And grade 3 hypertension is having a systolic blood pressure of 180 or more, or a diastolic blood pressure of 110 or more. And if you have blood pressure measurement in this range, it means you should seek urgent medical attention. Okay, so now we'll discuss some tips for measuring your blood pressure accurately at home. Firstly, you want to take your blood pressure at a similar time each day. Usually in the morning before breakfast is good, because you don't want to take your blood pressure after a heavy meal or after exercise, because that can interfere with the reading. You want to go to a quiet place where you can relax. Sit down in the chair and rest for a few minutes before taking your blood pressure. Then, when you go to put on the blood pressure cuff, you will see the picture on most cuffs. It'll tell you how to do it. It doesn't matter whether you use your right or your left arm, but normally we put on the left arm just above the elbow, and you want to position it so that the tubing is down the center. Make sure that it's not too tight or too loose. So put 2 fingers underneath the cuff, and that should be about the right tightness. And also you want to make sure that your blood pressure cuff is at the same level as your heart in order to get an accurate reading. So that might mean that you put your arm resting on the table or on the arm of your chair. Then you want to sit with your back against the chair. Don't cross your legs and don't speak during the measurement. Turn on the machine. It will inflate. It might be uncomfortable for a few seconds, but then it will deflate and it will show you what your blood pressure reading is. Wait a few seconds, and we normally repeat the measurement 2 to 3 times so that we can get an average of the readings. Make sure that you write down what the blood pressure readings are, the time and the date, so that when you go to show your doctor in the future, it can give them a sense of what your normal blood pressure is like at home. But what's great about this machine from Medicare is that it can sync your blood pressure readings to your phone via Bluetooth automatically. And that's great for helping your doctor decide what treatment you may or may not need to control your blood pressure. I'm now going to demonstrate how to take your blood pressure yourself. Firstly, you want to find a nice, quiet place where you've no distractions and nobody to talk to take your blood pressure. Roll up your sleeve above your elbow and take the blood pressure cuff so that it is about 1 or 2 centimeters above the crease in your elbow. Okay. You want to tighten the blood pressure cuff and make sure you can still get 2 fingers underneath so that it's not too tight but also not too loose. And you also want to make sure that this tubing comes out at the center of the crease of your elbow so that the sensor is in the correct position for measuring the blood pressure. Okay. So when you've that ready, make sure that the blood pressure cuff is placed at the same level as your heart in order to get an accurate reading. Make sure your legs are not crossed and flat on the ground. Breathe regularly and normally throughout the measurement, and then start the machine. And that's it. Once you hear the blood pressure cuff release, that's the measurement done. Make sure that you write down your measurement and then wait a couple minutes and repeat it 2 or 3 times and take the average of the latter readings. That's how you take blood pressure. So now we'll discuss ways of improving your cardiovascular health. You should know what your blood pressure is, keep track of it regularly, aim to be a healthy weight, eat less salt and more vegetables, drink less alcohol and always stay within the recommended limits, exercise regularly and aim for at least 30 minutes of exercise each day, don't smoke, reduce stress, and always take your blood pressure medication as prescribed by your doctor. So here are some pharmacist tips for measuring blood pressure. If you have a customer that comes in and wants their blood pressure taken, make sure that you have a quiet place to go and do that. Explain to the patient how blood pressure is measured and ensure that the blood pressure cuff fits them correctly. There are different size cuffs you can get, so you don't want that to be too tight or too loose. Afterwards, make sure you provide the patient with a written copy of their measurements and use that opportunity to encourage the patient to take their blood pressure medication as prescribed. Finally, if anyone does have an elevated blood pressure, make sure you encourage them to discuss that with their doctor or their GP. That's the end of the video. Thank you very much for listening, and I hope you found it useful.